Giving a bed bath. Definition: the washing of the patient on bed with soap and water. Assessment: assess patient's tolerance for activity, discomfort level, cognitive ability, and musculoskeletal function. Discuss patient's preference for the bathing procedure and personal articles. Assess the patient's skin for dryness, redness, or areas of breakdown. Objectives: to decrease the possibility of infection by removing excessive debris, to provide comfort for the patient, to assess the patient's overall status, and to maintain muscle tone through active or passive movement during bathing. Equipments. Good day, Miss. I'm Elizario, your student nurse for today. Your name is? So for today's procedure, I will be doing the bed bath. Procedure: close curtains around bed and close door to room if possible. Rationale: to ensure patient's privacy. Bring necessary equipment to the bedside stand or over bed table to save time and energy. Offer patient bedpan or urinal. Voiding or defecating before the bath lessens the likelihood that the bath will be interrupted. Perform hand hygiene to deter the spread of microorganisms. Loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove top sheet while patient holds bath blanket in place. If linen is to be used, fold it over a chair. Place soiled linen in laundry bag to avoid unnecessary exposure of the patient to maintain warmth. Remove patient's gown and keep bath blanket in place to provide uncluttered access during the bath. Fold the washcloth like a mitt on your hand so that there are no loose ends. Having loose ends of cloth drag across the patient's skin is uncomfortable. Lay a towel across patient's chest and on top of bath blanket to prevent chilling and keeps bath blanket dry. With no soap on the washcloth, wipe one eye from the inner part of the eye near the nose to the outer part. Rinse or turn the cloth before washing the other eye. Soap is irritating to the eyes. Moving from the inner to the outer aspect of the eye prevents carrying debris toward the nasolacrimal duct. Bath patient's face, neck, and ears, avoiding soap on the face if the patient prefers. Soap can be drying and may be avoided as a matter of personal preference. Expose patient's forearm and place towel lengthwise under it. Using firm strokes, wash arm and axilla, rinse and dry. The towel helps to keep the bed dry. Washing the far side first eliminates contaminating a clean area once it washed. Gentle friction stimulates circulation and muscle and helps remove dirt, oil, and organisms. Long, firm strokes are relaxing and more comfortable than short, uneven strokes. Place a folded towel on the bed next to the patient's hand and put a basin on it. Soak patient's hand in basin. Wash, rinse, and dry hand. Placing the hand in the basin of water is an additional comfort measure for the patient. Repeat actions 16 and 17 for the arm nearer you. Spread a towel across patient's chest. Lower bath blanket to patient's umbilical area. Wash, rinse, and dry chest. Keep chest covered with towel between the wash and rinse. Lower bath blanket to perineal area. Place a towel over patient's chest. Keeping the bath blanket and towel in place avoids exposure and chilling. Wash, rinse, and dry abdomen. Carefully inspect and cleanse umbilical area. Skin fold areas may be source of odor. Return bath blanket to original position. Fold towel near patient's foot area and place basin on it. Place foot in basin while supporting the ankle and heel in your hand and the leg on your arm. Wash, rinse, and dry, paying particular attention to area between toes. Supporting the patient's foot and leg helps reduce strain and discomfort for the patient. Placing the foot in a basin of water is so comfortable and relaxing and allow for thorough cleaning of the feet and the areas between the toes and under the nails. Repeat actions 22 and 23 for the other leg and foot. Make sure patient is covered with bath blanket. Bath blanket maintains warmth and privacy. Clean, warm water prevents chilling and maintains patient comfort. Assist patient to prone or side-lying position. Position bath blanket and towel to expose only the back and the buttocks. Positioning the bath blanket, the towel protects the patient's privacy and provides warmth. Wash, rinse, and dry back and buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area. Fecal material near the anus may be a source of microorganisms. If not contraindicated, give patient a back rub. Back massage may be given also after perineal care. Refill basin with clean water. Clean perineal area or set up patient so that he or she can complete perineal care. Help patient put on a clean gown and attend to personal hygiene needs. Protect pillow with towel and groom patient's hair. Change bed linens. Remove gloves and perform hand hygiene. Dispose of soiled linens according to agency policy. Record any significant observations and communication on chart. A careful record is important for planning and individualizing the patient's care.